So, good evening, friends. I am Dr. Vikant Verma. I am MD Medicine. So, today's World Hypertension Day 2022. World Hypertension Day is observed on May 17. World Hypertension Day is marked as a day which is focused on creating the awareness about the hypertension and its symptoms. Hypertension or high blood pressure occurs when the blood pressure rises to unhealthy level of 140 by 90. As we uh, all know, it's considered to have touched a dangerous level when the blood pressure goes over 180 by 120, which is also known as a hypertensive crisis. Over a billion of the people around the globe live with hypertension, and this very remarkably huge number of population, which leads to the cardiovascular and premature deaths worldwide. So, while hypertension was usually seen as a health condition found in older people, it's now become a quite common in the younger population also. So, high stress levels, obesity, poor dietary habits, and sedentary lifestyle are some of the major causes of the hypertension in the young people also. So, prolonged hypertension also puts a person at a risk of several medical conditions like stroke, cardiovascular diseases such as MI, heart failure, and others. So, first World Hypertension Day was observed on the May 2005 by the World Hypertension League, which is an umbrella organization of the 85 National Hypertension Society, which aims to create the awareness among the people about the condition. So the following day was observed on the May 17 as the World Hypertension Day, and is being continued after that. So every year there's a theme changing of hypertension. This year the theme of the hypertension is measure your blood pressure accurately, control it, and live longer. So now we come to the hypertension. Uh, some basics about the hypertension. So, as we all know, hypertension is defined as the increased blood pressure. For the common people, is the high blood pressure, which is a long-term condition in which the blood pressure in the arteries are highly elevated. So, where the systolic blood pressure will be more than or equal 140 millimeter of mercury, and diastolic will be more than or equal to 90 millimeter of mercury. So there are some classifications over the period of years. There have been so many classifications. Now these days we follow uh, only it's very simple classification. One less than 120 by 80 is normal. Elevated blood pressure is 130 systolic, and diastolic is less than 80. That is known as elevated blood pressure. And there's another category known as stage 1 hypertension and stage 2 hypertension. Stage 1 hypertension is when uh, the blood pressure is 130 to 130 to 139, and 80 to 89 is the diastolic. So stage 2 is whatever is greater than 140 by 90. So if blood pressure is 180 by 120, it goes into the hypertensive crisis, and we have to, that is an emergency, we have to deal with that very emergently. So, what are the etiologies? There are two types of, mainly types categorized, which is known as a primary hypertension and the secondary hypertension. Primary hypertension, 90% of the patients of the primary hypertension have no cause. So, this is also known as essential hypertension. Without hypertension without cause is primary hypertension, and secondary hypertension, there is a secondary cause that may be renal cause, that may be due to the endocrine cause, Cushing syndrome, that may be due to the cardiac cause, aortic nerving, or there can be some drug related causes. It can be due to sleep apneas, and some cirrhotic patients also have such kind of a secondary hypertension. So these people have few 5 to 10% secondary hypertension. So, what are the risk factors we should know? What are the risk factors which lead to the hypertension? So, age is one factor. With advancing age, we have tendency to get into the hypertensive stages. Another is regular habits of the people, such as smoking, alcohol, and diabetes mellitus is also one of the important factor which also contributes to the hypertension. And another is excessive dietary intake of the salt, and sedentary lifestyle, family history of the hypertension, stress related to the work or any other stress. So These are the main etiologies of the hypertension. And what are the pathophysiologies? We have pathophysiology categorized into different categories. One is sympathetic nervous system hyperactivity is also leads to the hypertension in the younger patients, mainly what we see. And activation of the vascular endothelium because of the sedentary lifestyle, smoking, toxins, whatever we introduce inside our body, the activities of the renal system, and activities of the endocrine system. So these all are also the contributing factors which can lead to um, hypertension. So what are the clinical features? What we see? So hypertension is also known as the silent killer disease because it may there can be patients can be asymptomatic. Most of the patients come to us in the OPDs and they will say, I had no symptom, but on during the routine investigations, I was found to have a a high blood pressure. So can it happen? So it's very common. 50 to 60% patients don't have any symptoms before coming to the hospital. So some people have very common symptoms which we see in the OPDs and which are documented are several. So some people have severe headaches, some people have epistaxis, some people have nausea, vomiting, myalgias, dizziness, vertigo, and some people also have chest pains, shortness of breath, irregular heartbeats, and some people have blood vision also. So these are the common symptoms which we can see, but these symptoms are not typical of hypertension. Hypertension, as I said, can be asymptomatic, and younger people, older people, middle-aged people, everybody can have hypertension. There is no clear-cut age preferences for the hypertension, because these days we are monitoring, more we are getting hypertensive people inside our OPDs. So how can we diagnose hypertension and how can we prevent it? Is just to you have to measure it accurately, and you have to go to centers where people are measuring the blood pressure accurately. But these days digital blood pressure machines are also available, so people can have a luxury of seeing their blood pressure inside their homes also, so they can prevent from themselves from the white coat hypertension some people suffer from. So uh, these are the things which we should take care of. And uh, how what would we do, what investigations will we do? That's just for the screening the secondary hypertensions, if or there are some target organ damages or some associated diseases such as diabetes mellitus or some other diseases, endocrine diseases or neurological diseases or some cardiac diseases. So we will do the investigations appropriately. So if you are found to have a blood pressure of a 140 by greater than 140 by 90, you have to visit your and see your physician immediately, because hypertension is a silent killer. Otherwise, it will lead to comorbidities and mortalities. And hypertension needs to be considered and to be seen with the utmost concern. All what are the managements? We have two types of management here, because one is lifestyle modification, another is pharmacological treatment. Both of the treatments have to be taken simultaneously. It's not that pharmacological treatment, if you take and if you are taking lifestyle modifications, and if you're not going for the pharmacological therapy, lifestyle modifications include daily exercises, reducing your salt intakes, avoiding sedentary lifestyle, and taking time for recreation, having adequate green leafy vegetables. And in pharmacological therapy, we have different classes of the drugs which you can be prescribed by your physician. So these are ACE inhibitors, angiotensin receptor blockers, beta blockers, calcium channel blockers, diuretics, and sometimes we have also alpha agonists. So these are the drugs which can be prescribed alone. Lifestyle modification is not successful. You have to consider both lifestyle modifications and the pharmacological therapy for treatment of the hypertension, because it's been seen some people avoiding the antihypertensives and just considering the lifestyle modifications of the utmost importance have led to serious consequences in the past also. And I've seen in the OPDs also people coming to OPDs, and at the younger ages they think that the exercise might put primary hypertension to end, and but this doesn't happen. the hypertension creeps up and patient might come up to you with some kinds of intracranial bleed. Sometimes some it can lead to the cardiovascular diseases, and this leads to the increased mortality and morbidity for the patient. For a younger patient, this is very disastrous. So for everyone out there, I just want to put a message that just screen your blood pressure yearly at least. Or if you cannot do that whenever as the randomly, you can just screen your blood pressure whosoever is there. Comorbid patient, every comorbid patient, whosoever has got the diabetes, old age patient suffering from any kind of a disease, infective or non-infective, they should always screen for their hypertension. More early you will screen your hypertension, more early the treatment will be started, and the treatment will lead to increase in the lifespan of the patient. And um, that's very much documented, and that's very much evident from the literature. So everybody has to see and look after their health by checking their blood pressure yearly. So I wish everyone out there good luck and healthy lifestyle. So my message is just go measure your blood pressure accurately and check it and live longer. Thank you. Thank you very much.